Good afternoon, everyone, and welcome. I'm Dr. Tasha Ellis with Mindful Talks, Dr. Tosh podcast, and we welcome back to you this episode for BIPOC Month, July 2026. This podcast is focused on all things health and wellness, and today we have with us Dr. Laklieshia Izzard, also known as Dr. Izzy. She is a licensed professional counselor and the former second vice president of the NAMI Board of Directors. She previously served as a director, a board member for NAMI Georgia, and a program leader and trainer for multiple programs and initiatives. She also served on the leadership team for her local NAMI affiliates. Dr. Izzy advocates on federal and state legislative levels for those with mental health conditions to remain out of the criminal legal justice system and to support inclusion for underserved communities. She currently serves on the Georgia Department of Behavioral Health and Developmental Disabilities Advisory Council. Dr. Izzy has written several faith-based therapeutic publications, which you'll hear more about later on in this podcast episode. She is the recipient of multiple awards and recognitions within her local NAMI community. Dr. Izzy is an alumna of North Carolina A&T University, and so we're delighted to have her expertise on this podcast today. And we'd like to welcome all to this episode on BIPOC Mental Health, that is Black, Indigenous, and people of color, healing and thriving through community. It honors the legacy of Bebe Moore Campbell, author, teacher, and mental health advocate. So we invite you to listen in, share, and also invite those in your circles. As a disclaimer, the information shared is educational and not a substitute for therapy. And so let's get started with our first question.
Thank
Before I
you,
get
Dr.
started, I'll
Emily.
ask Dr. Izzy, is there anything else she'd like to tell us about her stuff?
I think that was a wonderful introduction. Thank you so much for that. And thank you for having me today. But I will say, Aggie Pride from my Aggies, North Carolina A&T State University. You know how I have to support us.
Yes. And thank you for representing. I love the Afrocentric attire.
Thank you. Thank you so much.
So, as we observe Minority Mental Health Month, also known as BIPOC Month, what are
Mhm.
some national data points that you'd like to discuss in helping others to understand the significance?
Yes, absolutely. Really good question. And thank you for that. First, I'll share a little bit of data and research overall for multiple communities that fall within the BIPOC related community. And that is, I'm going to share some stats on Black adults, Hispanic adults, and Asian adults. So, when it comes to seeking treatment, which we know is essential, okay, for individuals of color, about 30% of Black adults will seek treatment. 27% of Hispanic adults will seek treatment, and 18% of Asian adults will seek treatment compared to white Americans. So, as we can see, those numbers are very, very low. And something I always like to share when I give statistics is that statistics are not just numbers, these are people. These are actual individuals. So, keeping that in mind, that we still have very low rates and numbers of individuals who are getting adequate and acceptable treatment or even any treatment at all. So, wanted to share that first. Next, I want to talk a little bit about our young Black males because our rates are steadily increasing nationally as it relates to our young Black males and their mental health conditions and challenges. Young Black males, suicide is now still the leading cause of death. It's the third leading cause of death among young Black males around the ages of 15 to 24. And also for young Black males ages 5 to 12, they are now 2 times more likely to attempt or to complete suicide. So, that, of course, is an alarming statistic, but it is a statistic that has been steadily increasing since 2017. So that's an area that we do need to address and have more attention around. And then the last one I'll share is that only about 1 in 3 Black adult Americans who need mental health treatment will actually receive treatment. That's when we start looking at difficulty accessing treatment. Many times that could be related to being underinsured or having no insurance at all, or just having challenges as a whole with obtaining and knowing the resources that are out there to get the treatment that they need. And I'll stop there.
Thank you for that very significant data pertaining to the BIPOC community. And as it relates to African Americans, what are some implications based on that data as it relates to their day-to-day functioning?
Day-to-day functioning, well, that's something that within our community we know that looks very different, okay, from other
Mhm.
populations. When you start to look within the Black culture and Black community, we know that there is a work ethic factor, there is a resiliency factor, where we just have that a part of our culture that we are going to do what we need to do to handle our business, okay? The other part of that is usually whatever challenges that we are enduring, that we are going through, we either handle it from the family standpoint, that level of support, friendship, sometimes social circle standpoint, but usually it stays within our community versus us trying to go out and to seek the necessary help that we need. When that happens, that builds up more stigma within our community. And when it builds up more stigma in our community, of course, it's going to hinder us and challenge us in those areas where we need the most support and we need the most treatment. So I hope that answered your question a little bit.
Yes, that certainly answers that. Because I know one topic that has been on the horizon is functional depression, and that people are, depressed, but they're still working and doing what they need to
Mm-hmm.
do in their lives. And we know that depression is highly prevalent across populations and can limit the potential of a person if they're not in treatment. So, how might a BIPOC person get started with seeking culturally competent care?
Mm-hmm, absolutely. Before we even talk about the culturally competent care piece, when we go back to that functionality piece that you were talking about, because we know within the Black community, depression looks very different for many of us. And so when it comes to functionality, many times we still can look at things like irritability. Okay, that usually can be a sign and a symptom that's letting us know that more is going on with us. We're not always as isolated. We still believe in getting out there, being involved, going to our church events, things like that. But at the same time, we're struggling with irritability, or we're just struggling with that phrase that I like to share with clients: I just don't feel like myself. That's usually the key phrase to let you know that more is going on with you, that your mood is lower. But as we talked about as an African community and the resiliency, we're still going to make sure the children are taken care of. We're still going to make sure we're being wife, to our spouse if we're married. Still going to make sure we're being children, we're being caregivers, to our parents. We're doing all of these things while experiencing depressive symptoms. But because it doesn't look like many times what other individuals think, that we're withdrawing, that we're isolated, that we're crying all the time, crying every day, having crying spells. But you can still be tearful, at times. Like I say, you can be irritable. You can have a low mood. You can feel that your body chemistry, it's not aligned, that it is something different that is going on. And usually that's the phrase that's going to come out, that I don't feel like myself. So that's the lack of functioning many times that we experience within the African community as Black women, and many times even as Black men. And on the other piece of that, Black men actually do experience depression at higher rates too, but many times they're misdiagnosed. They're misdiagnosed for something more so severe, such as a psychotic disorder,
Okay.
usually. And so that's always something to keep in mind when we're looking at functionality as it relates to the Black community and as it relates to depression. but it is very serious, and it is something that we should be addressing more, and that we should be talking about more, and that we should be talking about what those signs and symptoms look like, because it doesn't look like what we quote unquote consider to be the regular signs and symptoms of depression. Also, what we're learning too recently is women who have recently had children experiencing postpartum depression. Most women within the Black community don't even know what those signs and symptoms are related to postpartum depression. And many of them have experienced it or going through it, and they have no idea. So that's another area where we have high rates, and that's postpartum depression for Black women. And that is something too for us to start to bring more awareness out in talking about. So as you said, that leads up to culturally competent treatment. Because when you think about it, if our functionality looks different, if our signs and symptoms are looking different in these depressive areas and these other mental health conditions areas, we need someone that understands that. Someone that has really took the time to research and gone through the training to really be able to sit down and come in and to support our community. So culturally competent treatment really is just from a provider that has educated themselves, that has trained themselves on what the Black community goes through. Now, speaking on honesty as it relates to the Black community, many individuals want to go to someone that looks like them, and that's okay. That is all right. But the key is, do they know what to look for? Do they know what to look for and how to seek that specific level of treatment, looking for providers of color? So many times I share that with my clients that I see. I let them know, well, if my theoretical approach is not the one, that you want, let me give you some tips of what to look for when you're looking for another provider. So whether that's psychodynamic, whether that's trauma-based therapy, whether that's family-related trauma therapy, family systems therapy, what have you, whether that's expressive arts therapy, but I try to make sure that I give them some guidance of what to read in that person's bio so that they know that this person may have the culturally competent background that they need to get the treatment, of course, that they need. The other part of that is they can go to a provider that doesn't look like them if they want to. But those are questions too that they will need to ask that provider. They need to ask that provider, have you gone through explicit bias training, implicit bias training? Have you gone through culturally responsive treatment training? Have you gone through certain expressive arts therapy, such as narrative therapy, such as bibliotherapy, different types of therapy that we know that our community responds well to? And so those are questions. And then also faith-based integration. That's one of my specialty areas. That is culturally competent treatment, because within the Black community, we're known to hold strong to our faith. So our
Yes,
faith
indeed.
is a strength area for us. So it is important that faith is integrated into our treatment. That's a part of culturally competent care.
And you raise such great points, especially with regards to just because, the provider may be the same race or ethnicity as the client, that might not necessarily be the best fit. So it's
Mhm.
okay to look at other options and seek those with a certain treatment orientation that you're comfortable with. And also certainly considering the faith-based strengths that often people of color draw from, and doing your research to see, who has that expertise, who's qualified, because qualification is also important.
Indeed. And I've actually had clients, Dr. Ellis, that come to me and that's what they said. They said, I chose you because you had faith based in your bio. They didn't look at anything else. All they saw was faith based. And they said, that's what I've been missing. Many of them had had treatment before and therapy before. And they said, I hadn't had a provider that knew how to integrate faith into my treatment. And I know for sure that that's what I've been missing. That's the missing piece. And so I do have, of course, my own treatment approach, and I know we'll talk about that a little bit later, but faith inspiration therapy. So it's something that I've been using for quite some time since I've been in private practice, since I think that's 2015, 2016, somewhere up in there, and so grateful, of course, to be in private practice, telemental health. It's a great opportunity, great opportunity.
So as we talk about Black, Indigenous, and people of color and their help seeking this month, what are some misconceptions as it relates to these groups that you'd like to
Mm,
shed light on?
absolutely. Well, I think number one is something that we have to look at as a whole within a community first, and that's our stigma within our community. And that is experiencing what we think is weakness when it comes to seeking help. That many times can be a huge, huge barrier within our community as it relates to us getting the treatment and the help that we need. It has nothing to do with weakness. The other part of the stigma is that person thinking that somebody is going to call them crazy, or think that they're going to have a mental health diagnosis attached to them. A label is what I used to hear it called in my community. I also used to hear it say, oh, well, that person, is going to get a crazy check. You see, so again, these are stigmas that we have to address first within our own community to make sure that we are not adding to misconceptions that may be out there as it relates to our community. So that's number one. And then number two is the fact that, of course, we are a strong people. We are a resilient people. But does that mean that we are without distress? Absolutely not. So that's many times what I share anytime I get that question. I go, well, what about, the Black community and people saying they really don't need treatment? What? Just because we are strong, just because we are resilient people, that doesn't mean that we are without distress. And what that means is our mental health can be compromised too at any time. We just have the capacity to overcome. But because we have the capacity to overcome, we need tools, we need skills, we need to be able to release. Okay. We need to know what self care looks like for us so that we can overcome, but we can overcome in such a way that we are healthy, that you're not just overcoming and you're not healthy. Okay. And that lets us know many times that we're not healthy when we look at the physical health conditions within our community. When we look at the high rates of diabetes, the high rates of high blood pressure, the high rates of strokes. You see what I'm saying? So it's letting you know that stress is infiltrating, our community. And then don't get me started on the political unrest and the racial trauma and the systemic racism and institutional racism, okay, and the disparities that our community experiences and the food deserts. All of those things still contribute, okay, to many times what we are experiencing as it relates to our mental health being compromised. And so when the misconceptions are shared or are spoke about, we have to speak up and say that we are not without distress. And there are multiple challenges that we are facing within our community that we have to address, that we have to bring awareness to, so that we can get the resources and the support and the treatment that we need.
Thank you so much for that, Dr. Izzy. And I know that you've hosted an annual symposium through a local church here in the Atlanta area. And as we reflect on the church, as a natural support in communities, how might that avenue be used further to engage with BIPOC communities?
Absolutely. Thank you for asking that question. Yes, so I've been blessed and I've been privileged to host the Black Men Thrive Wellness Symposium in partnership with the church that I'm a member of, which is Berean Christian Church in Stone Mountain, Georgia. And so we really have been blessed doing that symposium over the past 4 to 5 years. Prior to that, I did it a couple of years with some of our helping associations here in our local state, or Great Peach State of Georgia, should I say. But But we've done well in getting that awareness out there. We've done well in helping to fight that stigma. We've done well in addressing those barriers. We've done well in looking at as it relates to the social change piece, the racial trauma piece, the systemic racism piece, and looking at again what we need to do to further support our Black men, to make sure again that they are aware of their resources, that they know that they can open up and that they can share. And the key reason for creating that symposium was to hold space, hold safe space for our Black men as well as our Black community so that they can come in and learn, and they can also come in and share about the challenges that they have been having around their mental health. So I do think doing the symposium for the last 7 years has been a benefit to our local community, and it's also been a help to get the resources out, which was something that I was blessed to do as well, is bring in our local resources like the Georgia Department of Behavioral Health, like the National Alliance on Mental Illness, like our local community service boards that serve underserved communities. So many individuals within our Black community had no idea that these resources exist.
And very important that you mention a safe space, because oftentimes people in our communities want to know that they can come to these safe spaces to engage and learn and also connect. I'm sure some of the participants have made connections there, whether it be friends or informal peer supports. And we know that peer support itself is a crucial piece to the mental health system of care, and that you can have that trusted person to confide in, someone who's actually experienced mental illness and recovery. So thank you again for hosting those symposiums.
You're welcome.
As it relates to adverse childhood events such as abuse and trauma, we know that there is a high prevalence in certain BIPOC communities, and that places these persons at risk for involvement in the justice system. Based on your expertise, and also the people you've engaged with through symposiums in that arena, what are 2 to 3 early intervention approaches that you would see in terms of mitigating this risk?
Absolutely. Well, first, I'll share a little bit more on ACEs, which is short for Adverse Childhood Experiences, that it is a public health concern. And it's a real public health concern. You can research on your own on the CDC website. The CDC has considered it a public health concern / crisis. So if you go on the CDC website, they're going to give you all of the trauma areas related to adverse childhood experiences. They're also going to give you community related resources as well as different types of interventions. But it's something too that the National Alliance on Mental Illness is working with as well. One of their strategic drivers is early intervention. And so you definitely asked the right question, Dr. Ellis, about early intervention. Early intervention can look like counseling, okay? It can also look like support, meaning support type groups, okay? Also, we're learning now in the research as it relates to communities of color. It can look like social related organizations and events, such as mentoring programs, literacy type programs. All of those interventions can still be a help to our young people that have experienced certain levels of trauma. But the key thing to understand about adverse childhood experience is if there is no intervention, what the result usually is. And that is that young person, 8 times out of 10, is going to develop some form of a mental health condition. Okay. CDC also reports that those children that do not receive any type of early intervention can shorten their lifespan by 20 years. Okay. 20 years. That can be in multiple ways that can happen, whether it's through them having a severe mental health diagnosis, whether that is suicide, okay, or something else that puts them at risk of losing their life or having their lifespan shortened, okay, because of that trauma not being addressed. The other piece that we're speaking about, which is the justice system piece that you spoke of, the research lets us know that BIPOC youth, okay, with behavior and mental health challenges are usually, okay, at high risk of being disproportionately diverted into the juvenile justice system rather than being referred to mental health treatment. And the other area that's alarming when it comes to mental health related treatment is that the number one mental health provider in our nation is, unfortunately, the criminal legal system. And so, for many individuals within communities of color, sometimes their first experience with mental health treatment or care, unfortunately, is in the juvenile justice or the criminal legal system as a whole. So that's something that we are working on within the mental health community as it relates to programming to divert individuals with mental health and substance use challenges away from the criminal legal system. One of the key programs that's fairly new here in Georgia is called our co-responder model teams. So that is when a crisis call comes in to 911, we can send out what they call a co-responder team. That's a licensed behavioral health clinician. That's a CIT, that's a crisis intervention trained law enforcement officer that has a background in understanding mental health and crisis. And then some teams also have what we call a certified peer specialist. That's a person with lived experience that actually probably has a mental health related diagnosis or have gone through mental health or substance use related challenges themselves, okay? And that is in now recovery. But that whole team is sent out on that crisis call so that if this person is showing signs and symptoms of a mental health or a substance use challenge, they are going to divert them into treatment rather than taking them into custody into the criminal legal system. So that's number one, co-responder model. Also, number two, there are about 5 to 6 counties in Georgia now that have what we call the Stepping Up Initiative. The Stepping Up Initiative is a national initiative that helps to reduce people with mental health and substance use challenges as well out of the criminal legal system. That is done by developing programming within specific counties to make sure that those programs are there to house, to connect, to treat those individuals so that they do not go into the criminal legal system. And so, again, we are working as a field, as a mental health field, to develop programming that is diverting people out of the criminal legal system. Georgia is still doing a really, really good job. There's some other programs out there that I'll have a chance to go into, but they have at least another 3 or 4 really, really great programs too that are helping in that area. But this is a very important area. It's a very critical area to keep talking about too and bring awareness to and addressing because, again, just as I said, the number one mental health provider in our nation is the criminal legal system.
Thank you for explaining that and especially touching on the early intervention pieces, including things like social organizations, also getting involved with youth activities and mentoring. All of those are crucial. And also the systems approach. So I appreciate myself as a healthcare professional when systems work together, including the mental health field, the local hospitals, as well as law enforcement, because that crisis intervention team itself is very critical to have law enforcement that understands mental health and how to work alongside clinical professionals to mitigate that risk.
Yes. And I'll share one last thing, Dr. Ellis, with that. And we need help. Okay. We need volunteers to do this work. So, public health advocates like you, mental health advocates such as myself, it's needed many times to push this community work forward. In Newton County, I am the chair of our Stepping Up initiative here. And so, actually, next week, we will be having what we call our sequential intercept map training for our community. This is where we bring community stakeholders and community partners that have the mental health and the criminal legal background Okay. And we will all come together for 2 days and we will discuss the needs here in Newton County as it relates to resources and programs that exist, but also the programs that we are in need of so that we can make sure to divert more individuals with the mental health and substance use challenges out of the criminal legal system. So sometimes it takes us as public health leaders, mental health leaders, and advocates to make sure that we are here to help move the needle and be a part of our community's success and be a part of the work that really needs to be done to help the people within our local community. So, yeah, so we need you.
Well, thank you again, Dr. Izzy, for being that leader and also stimulating change within our communities, especially locally as well as nationally through NAMI. And it's been a pleasure having you as a guest on this podcast episode. Tell us more about where we can find you and also your publications.
Absolutely. Well, I do have a website. So that is Shekinah CTS, and that's .com. So that's SHEKINAHCTS.com. Also, you can find me on social media as well as Shekinah Counseling. That's a business page of mine. And then my public servant business page is just my name, Dr. Laklieshia Izzard, as well as my LinkedIn. It is my name as well, Dr. Laklieshia Izzard. So that's how you can find me. And my publication, Faith Inspiration Therapy, which is an integration of cognitive behavioral therapy along with biblical principle, as well as biblical scripture reference, as well as some holistic interventions as well are within those publications. But all of my publications are available on Amazon. If you put my name in, Dr. Laklieshia Izzard, all of them will come up. So thank you so much, Dr. Ellis, for having me today. I enjoyed having this conversation. As you can see, I'm very passionate as well as compassionate about this particular work, working in our communities of color and serving individuals who have unfortunately been underserved.
Much gratitude to you, Dr. Izzy, for sharing with us today and also your passion, as well as letting the audience know where to find you. We appreciate the audience for tuning in to this podcast episode. We will be sharing this on Spotify. And until next time, be well, live your best life, and be on the lookout for more episodes on Mindful Talks with Dr. Tosh. Thank you and have a wonderful day.